Hi, thanks for listening. I'm here to introduce our work, Reinforced Epidemic Control, Saving Both Lives and Economy. In the recent 6 months, people are struggling with the COVID-19 epidemic. There is a debate between a strict or a loose epidemic control. A strict epidemic control severely harms the economy, while a loose control leads to an epidemic outbreak and causes incalculable deaths. An ideal way to save lives and protect the economy is to flatten the infection curve lower than the healthcare capacity and return as much as economic activities. The question is how to achieve such a win-win policy. There is the trilemma rooted in epidemic control. The individual tracing and quarantine policy, though effective, threatens privacy. Further, it's nearly impossible to trace all the contacts when there is a large number of asymptomatic patients. The city lockdown or reopen policy either harms the economy or cannot control the epidemic. These demonstrate a trilemma between infections, economy, and privacy. To resolve the trilemma, we propose to control inter-regional mobility. The goal is to lower the probability of risky movements. To do so, we distribute a quota rate for the movement between each two regions, which determines how many of the movements are approved. With only relying on regional statistics, the private data is dispensable. Controlling inter-regional mobility is a high-dimensional sequential decision problem. It's challenging in 3 aspects. First of all, the vast and time-varying modern traffic makes it hard to estimate the virus spread risk hidden in mobility. Second, a practical and interpretable objective function is needed so that the government could understand and adopt the policy. Meanwhile, the object function should also be training-friendly. Third, the optimization for the dual objectives is hard. The exponential nature of epidemics induces a strong incentive to avoid infection increasing during policy searching, which disencourages exploration and leads to local optimals. With the consideration of those challenges, we propose a GNN-enhanced reinforcement learning system called DUNACA to search for policies. We use GNN to estimate the mobility risk, as mobility is a dynamic flow on a graph. However, existing GNNs are incapable to characterize the virus spread process. Thus, we propose a novel GNN architecture called the flow GNN to fit the epidemic dynamics. Our well-constructed reward function exponentially penalizes the hospitalization load and the quarantine duration. Thus, the penalty will boom once the hospitalized population exceeds the city's healthcare capacity or a region is continuously restricted. Finally, to improve exploration efficiency, we generate a pseudo-expert to guide exploration. Besides, we forbid the agent exploring some apparently unreasonable policies, so that to reduce the cost of exploration and help the agent get rid of local optimals. Last but not the least, we mimic the government's view. The agent has to make a decision without seeing asymptomatic patients. We evaluated DUNACA on a real-world dataset connected in Beijing. DUNACA gives a sophisticated policy, shown on the left quota distributing visualization. Experiments show DUNACA could retain most of the mobility as well as keep infections at a very low level. Even start to intervene after 20 days of discovering the first patient, DUNACA still retains 76% mobility while keeps the peak hospitalization demand under 1.4 per thousand. Meanwhile, no region suffers continuous restrictions. Compared with DUNACA, expert policies are either too conservative that retain little mobility or too loose that lead to an epidemic outbreak. Thus, DUNACA is irreplaceable. For more information about DUNACA, please refer to our paper. Thank you very much.